Welcome back to Doc Saying Stuff. As a primary care physician or PCP, I have to be ready to recognize and treat vaginal yeast infections. First off, a vaginal yeast infection is a fungal infection that causes irritation, intense itchiness, and discharge of the vagina and vulva. They occur when too much yeast grow in the vagina, leading to inflammation. You will all hear the term vulvovaginal candidiasis as well. The reason it's called vulvovaginal candidiasis is because it's referring specifically to the most common fungus that causes this infection. When you look at yeast infections, typically yeast fungus can live on our skin and inside our body. Candida specifically is a fungus, and Candida albicans is the species of Candida that causes 80% of fungal infections in humans. For women who have female reproductive organs, the most common symptom is vaginal itching, but they may also experience soreness, swelling, dysuria, which is painful urination, painful sex, and discharge. Due to culture taking 48 to 72 hours, healthcare practitioners mostly diagnose clinically. Half the individuals treated are objectively confirmed to have the presence of Candida in the vaginal area. We typically diagnose as uncomplicated or complicated. I think it's really important to think of the risk factors for the complicated vulvovaginitis patient. They typically will present with recurrent infection and severe symptoms. They may also have non-albicans candidiasis, which would be another species of Candida. Clinically, they could have diabetes or they're immunocompromised in some way. Pay attention to these factors as treatment differs for complicated versus uncomplicated. Topical and oral therapies like fluconazole or clotrimazole are just fine for uncomplicated vulvovaginitis. Fluconazole for 3 to 5 days is typical oral therapy. 3 or more episodes in the last 12 months confirm recurrent vulvovaginitis. If this is you or your patient, we may want to specifically diagnose the fungus causing the symptoms and narrow an antifungal that specific organism is sensitive to. If the infection is caused by non-albicans Candida, treatment may need to be altered as well. Probiotics, which are taken by a lot of different people, are not really recommended for the treatment of vulvovaginitis, although this is a very hot topic and you guys hear about this all the time. In pregnancy, guidelines currently suggest only topical azole therapies, so consult with your physician. If you develop symptoms of burning in the vagina or vulva, you may have a yeast infection. You should contact your healthcare provider for therapy, especially if you have diabetes, are immunocompromised, or debilitated. Thanks for joining us today on Doc Saying Stuff.